Hello guys, this video is the continuation of the orthopedic series in which I talked about the structure of the bone. I also talked about the histology, the history, as well as the physiology of the bone. Now it's time that we focus on some of the diseases of the bone. So guys, I have not made the PowerPoint or the notes beforehand because it really takes a lot of time from my side. So I just want to help and I just want to deliver the knowledge that I already have. So let's begin with the diseases of the bone. Now, if you remember from my previous video in which I mentioned about the histology of the bone is made up of two parts, but that is osteoid, as well as the bone also have minerals. Now, if you remember, osteoid is actually composed of two things, that is the cells and the proteins, right? And what are the minerals we have? We have calcium basically, which is present in the form of calcium, that hydroxyapatite, right? So, okay. So now what we're going to do is, and this calcium is actually increased in body by vitamin D, with the help of vitamin D. So remember this. Now what we're going to do is we're going to look at the diseases that cause problems with the cells, problems with the proteins, or problems with the minerals. So let's start with problems with the minerals, which is the most easiest part, and I believe most of us already are familiar about these. So now, in what diseases will the minerals be affected? In the diseases, and whatever diseases, vitamin D will be affected, right? So let's say, or nutrition will be affected, which leads to decrease in calcium. Now, when there is defect in mineralization of the bone, there are diseases that happen in children and in adults. Now, the disease that happen in children due to defective mineralization is known as rickets, and the same thing when happens in adults is known as osteomalacia. Okay, so again, what is happening here? Well, basically we have deficiency of vitamin D. Now, this decrease in vitamin D is leading to decrease in calcium in the blood. Now, decrease in calcium in the blood means what? Decrease in calcium in the bones, right? So bones will become what? Bones will become, of course, weak, right? So in rickets, when this type of pattern is seen in children, then we call this disease as rickets, and when this is seen in adults, we call it osteomalacia. Now we are going to discuss these diseases together in the other video. So this is about the problems with mineralization, right? Now there's one more thing that's important to understand here, and that is when we do the lab diagnosis and check the serum levels of calcium, in both of these diseases, calcium levels in the serum will be decreased, right? Because of course this is a problem with mineralization. There is decrease in calcium, so serum calcium levels will decrease. Okay, now the next thing that we go into is osteoid. Now when we talk about osteoid, we would have either problems with cells or with proteins, right? So let's talk about proteins first, because this is one of the easiest part. So there are two diseases that we're going to talk about in this case, and that is osteogenesis imperfecta and scurvy. Now how do we actually, what's happening here? Now let's talk about scurvy first, right? So there are two proteins called as lysine and proline. Okay, now these proteins actually undergo hydroxylation and form hydroxylated proteins. Okay, they undergo hydroxylation and form hydroxylated proteins, right? Now this hydroxylated proteins is actually responsible for cross-linking of collagen 1. Now if you remember in my previous video, I told you that the collagen that is present in the bones is actually collagen number 1, right? It's also present in meniscus, it's also present in eyes, in teeth, right? So this cross-linking is actually provided by hydroxylated proteins, and this hydroxylation process needs vitamin C. Okay, now if you have deficiency in vitamin C due to whatever reasons, basically nutritional reason, this cross-linking of protein will not take place. Now, when the protein when the collagen is not cross-linked, this will lead to decrease in strength. This will lead to this decrease in strength of the bone that is formed. Okay, so now this decreased deficiency of vitamin C is actually known as scurvy. Okay. Okay, so there are some differences between scurvy and rickets, which we are gonna also discuss in the next video. Okay, now the other one is if this procollagen, well, we call it procollagen 1. So we have type 1 procollagen or procollagen type 1. Okay, that is actually deficient. This procollagen type 1 is deficient or is not present, let's say, in osteogenesis imperfecta, depending upon whether it is autosomal dominant or autosomal recessive. Okay, well, dominant usually are stillborn. Well, there are some recessive which are born, but these children usually die at an early age. So what is osteogenesis imperfecta? It is a genetic issue which can either be autosomal dominant or recessive, which actually leads to defect in procollagen type 1. Basically, collagen type 1 defect. There is defect. That means there is defective bone formation. There won't be any bone formation. There won't be any cross-linking. So basically, the problem is with collagen, right? And protein matrix contains collagen. So when there are two issues that we see with proteins in bones, that is osteogenesis imperfecta and scurvy. Now let's move on with the cells. Now I'm going to draw these cells. I'm going to talk about the two cells that are most abundant. Most abundant are definitely osteoblasts, and of course we're going to also talk about osteoclastic problems. So this is the easiest topic in orthopedics. When the toughest issues I found in orthopedics is basically in joint deformities, when we talk about the Galeazzi, fractures, etc., etc. Anyways, this is not the topic here. So let's talk about osteoblasts. Now, we can talk about increase in osteoblastic activity or decrease in osteoblastic activity. Well, increase can be seen, of course, in tumors, right? So when you have tumors, you can have increase in osteoblastic activity. So this is a topic that we are going to discuss very soon in tumors of bone. So tumors of bone is a recurrent is a topic that occurs again and again, both in FMGE and NEET. Okay, so we'll discuss about it. And the second one is osteoclastic. So osteoclastic, we're gonna see two diseases here, and these are increase in osteoclastic or decrease in osteoclastic activity. Now, increase in osteoclastic activity is actually seen in Paget's disease. Where? In Paget's disease, right? We're going to look into Paget's disease in the next video. Maybe I'll make another separate video for Paget's disease. So this is commonly seen in elderly population. Sometimes the triggers are unknown. Usually triggers are unknown, but it could occur after a viral infection or something. Okay, so there is increase in osteoclastic activity in these patients, and this leads to Paget's disease, which leads to basically resorption of the bone. And the other one is Osteopetrosis, not Osteoporosis. This is Osteopetrosis. In this, there is decrease in osteoclastic activity. Okay, and this is actually due to genetic defect. This is a genetic defect in bone, osteoclast basically. So genetic defect in osteoclast. This disease is also known as marble bone disease, because the bone, when you see it so white, it looks like marble. Why will it look like marble? Well, it's understood that there's increase in osteoblastic activity when bone is formed more, but clastic activity is decreased, so bone is not resorbed. So that's all about the diseases of the bone. I'm going to see you in the next video with particular diseases. Thank you very much.